Hi, my name is Lynn Connor, and I'm a registered dietitian and certified diabetes educator at the West Champlain Family Health Team. Today I'd like to speak to you about prediabetes. About 6 million Canadians are living with prediabetes, and 1 in 3 Canadians either has prediabetes or type 2 diabetes. So I thought it'd be an important topic to speak about. So what is prediabetes? Prediabetes is a condition where your blood sugar or blood glucose levels are higher than they should be, but not high enough to be diagnosed as diabetes. Prediabetes increases your risk of developing type 2 diabetes. It also increases your risk of developing cardiovascular or heart issues, and it may also predict cognitive decline or memory impairment. Think of prediabetes as a caution or a warning sign, where green is normal blood sugar, the yellow is prediabetes, and red is diabetes. What are the warning signs or symptoms of prediabetes? Most people do not show any signs of prediabetes. However, you may experience increased thirst or increased hunger, frequent urination, feeling more tired than usual, or having a lack of energy. Erectile dysfunction is also a common symptom. Cuts and bruises that take longer to heal, and also blurred vision. What are the risk factors for prediabetes? Age is a risk factor, so being over the age of 40, however, it can develop at a much younger age. In fact, many children are now developing type 2 diabetes, and they would have had prediabetes beforehand. Having a parent, brother, or sister with diabetes increases your risk. Weight or waist size, and a larger waist size will increase your risk of developing prediabetes. Race or ethnicity, for example, people of Indigenous, African, Hispanic, South Asian, and Asian descent are at a higher risk than Caucasians are. Inactivity or having a sedentary lifestyle, an unhealthy diet, and women who have had gestational diabetes, so diabetes while they're pregnant, are at a higher risk of developing prediabetes. How do you reduce your risk? Watching your weight. Even losing 5% of your current weight will reduce your risk of developing prediabetes. Making healthy food choices, and being physically active. I'm going to speak about nutrition. I'll start with a little bit about digestion and what does happen when we eat different foods. Don't worry, I'm not going to go through this slide. It just shows a person eating. Food goes into the mouth, down the esophagus, to the stomach where it's churned, etc., etc. So what happens when we eat food? When we eat food, much of the food is broken down into a type of sugar known as glucose in our bodies. Glucose is our main source of energy or fuel, and it's the fuel that our brains prefer. Imagine that you've just eaten a meal. Much of that food will be broken down into glucose. That glucose then enters your bloodstream. Our bodies are made up of millions and millions of cells. So we have muscle cells, liver cells, fat cells, etc. And our cells need glucose for energy. So the glucose has to leave your bloodstream and somehow enter your cells where it's needed for energy. Normally, the next thing that occurs is the pancreas, which is an organ behind your stomach, produces insulin, which is a hormone. And insulin is the key that unlocks the door to your cells and allows glucose to enter your cells where it's needed for energy. That's what happens normally, and I'm just going to show you an illustration of that. I'll get myself out of the way here. So this shows a picture of the cell, and insulin is the key, and glucose is waiting to get inside. So insulin is the key that unlocks the door to your cells and allows glucose to enter. from your bloodstream into your cells. Your cells need glucose for energy. Remember, glucose is a type of sugar. And glucose is the fuel that our bodies run on and our brains prefer. So what happens to glucose in prediabetes? If you have prediabetes, your pancreas may not be producing enough insulin, or your cells may be becoming more resistant to your insulin. And you've probably heard of insulin resistance before. If this happens, it's more difficult for the glucose to enter your cells where it's needed. The glucose then tends to build up in your bloodstream, raising your blood glucose. When I say blood glucose and blood sugar, it means the same thing. Again, what are the risks of prediabetes? Prediabetes increases your risk of developing type 2 diabetes. It also increases your risk of developing cardiovascular disease or heart disease. It also, insulin resistance, which is common with prediabetes, may also predict cognitive decline, specifically memory impairment. And this is according to the American Diabetes Association. So let's talk about a healthy diet. It does not have to be complicated. It really doesn't. Keep it simple with something called the plate method. So in this slide, I'm showing you a fairly healthy plate. And we'll talk about the plate method here. Half of your plate is non-starchy vegetables. Non-starchy vegetables are those vegetables other than potatoes, sweet potatoes, and corn. So non-starchy vegetables would include things like broccoli, cauliflower, peas, carrots, peppers, lettuce, spinach, zucchini, etc., etc. And you can include some fruit here if desired, or you can have some fruit for dessert. 1/4 of your plate is protein. And by protein, I mean meat, fish, poultry, eggs, nuts, seeds, tofu, cheese, and legumes. The remaining 1/4 of your plate is grains and starches, preferably whole grains more often than refined white grains. And grains and starches include potatoes, corn, pasta, quinoa, couscous, brown rice, barley, etc. So you can see it's a fairly simple way to plan your meal. We can use the plate method for breakfast as well. And in this example, the grains and starches are, well, in this example, it's whole grain toast. It could be an English muffin, high fiber cereal, oatmeal. Protein, in this example, it's egg and peanut butter on the toast. But it could be nuts and seeds, could be cheese, could be leftover chicken if you like. Fruit, in this example, we have strawberries and blueberries. And one thing I'd like to note here is I recommend eating the whole fruit rather than drinking the juice. Juice is a liquid, it goes into your system quite quickly and can cause your blood sugar to spike, whereas whole fruit takes a little longer to digest. Vegetables are optional at breakfast time. In this example, we have spinach. You may have an omelet with several vegetables in it. Why use the plate method? Because it's simple. It's a simple way to plan a balanced meal and a balanced diet. And a balanced diet consists of a variety of sources of vitamins, minerals, and macronutrients. Macronutrients just means large nutrients. Macro means large. Vitamins and minerals are micronutrients. Micro means small. So macronutrients includes carbohydrates, protein, fat. We need all three in order to be healthy, but in the right amounts. Carbohydrates break down into glucose, which, as you remember, is the body's main source of fuel or energy. So we do need carbohydrates. And sources of carbohydrates are grains and starches, again, potatoes, corn, cereal, breads, rice, pasta, quinoa, barley, etc. Fruit, milk and alternatives, That includes yogurt, soy milk, cow's milk, evaporated milk, etc. And non-starchy vegetables contain a small amount of carbohydrate. And non-starchy vegetables include things like broccoli, cauliflower, carrots, zucchini, peppers, lettuce, spinach, etc. Carbohydrates are a fast-burning fuel, which means we use them up fairly quickly, and then we get hungry soon after. So the goal is to do something to try to slow down digestion so food stays with you a little longer. And that's where protein comes in. Protein sources include meat and alternatives. So examples are eggs, fish, poultry, lean meats, tofu, nuts and seeds, nut butters, cheese, and legumes such as kidney beans, lentils, chickpeas, and hummus. And as I mentioned, protein slows down digestion and helps you feel full longer. The other benefit of protein is because it slows down digestion, that means food is going to be broken down more slowly into glucose or sugar, which means your blood sugar levels aren't going to rise as quickly or as high. So protein also helps to stabilize your blood sugar levels. And finally, fats and oils. Sources of fats and oils include olive oil, canola oil, butter, and non-hydrogenated margarine. You do need some healthy fat in your diet daily, and some of the functions of fats and oils are the absorption of fat-soluble vitamins, so those are A, D, E, and K. They're also needed for making hormones, etc. There are several roles, which we won't get into here. That will be another presentation, as well as the quality of fats. There are healthy fats and less healthy fats. So how do we put all this together? Remember the plate method? Half your plate is non-starchy vegetables. A quarter of your plate is your protein foods. And the remaining quarter of your plate, grains and starches, are known as carbohydrate foods. Keep it simple. You can have some fruit for dessert if you like, or some fruit with your vegetables. And a low-calorie beverage, such as water, tea, coffee. If you're a milk drinker, you could have a glass of milk here. So to summarize, to reduce your risk of developing prediabetes, you can take action now by managing your weight. And as I mentioned, even losing 5% of your current weight will reduce your risk of developing prediabetes. Following a healthy, balanced diet, keep it simple, remember the plate method. Being physically active, and the goal for physical activity is 150 minutes of physical activity per week. And you don't have to do that all at once. You can divide that however you like. It could be 3 sessions of 50 minutes, 5 sessions of 30 minutes, 20-minute blocks, or 10-minute blocks. It all adds up. And if you haven't been physically active, I would suggest checking with your doctor and starting small. You know, even going for a 5-minute walk to start. And your goal could be, I'm going to go for a walk 3 times a week for 5 minutes. It doesn't sound like much, but it's 15 minutes more than you did last week, and you just build upon that. And by physical activity, we mean cardio as well as strength exercises. And cardio could be walking, dancing, swimming, cycling, going on an elliptical machine, could be kayaking. And it's an exercise that gets your heart rate and your breathing higher than normal. And resistance exercises, you could use light weights or those stretch bands. Now, if you'd like to assess your risk to see if you are at risk of prediabetes, there's a questionnaire at the Diabetes Canada website, and it's called the CAN Risk questionnaire. They're going to ask you questions such as your age, your height, your weight, whether you have someone in your family with diabetes, for example. And it's an interactive tool. It will tally your score, and then at the end, it will tell you whether you are at a higher risk of prediabetes. If you are, I would encourage you to get in touch with your healthcare provider. Thank you for listening.